Hi, I'm Dr. Jamie Freer, and today I'm going to explain the gut brain axis. So, when someone has issues like reflux, constipation, bloating, or food sensitivities, I want to look further than just digestion. So, your gut and your brain are in constant communication, and that connection is called the gut brain axis. The way they communicate is through nerves, hormones, chemical messengers that are made by gut bacteria. And so, if the brain is stuck in a chronic stress mode or fight or flight, digestion often slows down. And if digestion isn't working well, then the brain can be stuck in this chronic stress mode or fight or flight, and it becomes this loop or this cycle. And so, what my goal is to help your nervous system shift out of this survival mode and get into a state where digestion is happening. Your body is healing and regulation can happen. So, when your body is constantly feeling stressed or anxious, whether it's from emotional stress, birth stress, illness, or sensory overload, the nervous system stays in chronic fight or flight. So, blood flow is then pulled away from the gut, digestive enzymes decrease, hormones like cortisol will increase, and then the gut becomes more sensitive and reactive. And what we're helping with care is by improving the communication between the brain and the gut, supporting the parasympathetic nervous system, which is what we call the rest and digest activity, and reducing the baseline for the nervous system, which is stuck in stress. And so sometimes when we start working in this, we start looking at somebody's breathing. So, breathing is one of the fastest ways to talk to the nervous system. So, shallow, rapid breathing activates stress hormones. So, think of it like when you're walking and you're like huffing and puffing. This is going to suppress digestion and it's going to reduce your vagal tone. Slow diaphragmatic breathing is going to stimulate that vagus nerve. It's going to improve the gut motility and it helps regulate your emotions and your anxiety. See, breathing isn't just about oxygen, it's about telling your body whether it's safe. And if it's safe, then your gut can digest. When we start looking at physical exercise, we're going to look at core and anti-gravity muscles. So movement, especially posture and core stability, plays a big role in that gut-brain communication. The brain relies on the postural muscles, the anti-gravity input, and this proprioceptive feedback. And so when posture or core muscles are underactive, the nervous system stays dysregulated, digestive organs don't get optimal support, and then hormonal signaling can be imbalanced. So, what I want you to take away is good posture helps your brain feel more organized. And when your brain feels organized, then your gut can work better. So, in chiropractic, we're not just treating symptoms, we're helping the nervous system regulate so your gut, your hormone, and your brain can work better together. And the way that we do this is through chiropractic care, regulating the nervous system. Sometimes I give patients some breathing strategies to help regulate and start activating that vagus nerves. We also do postural and movement support to start working on those core and postural muscles, and then we help with emotional regulation. So, what we're doing is we're helping break this stress digestive imbalance in this loop to help support long term healing. And so, what we have found is when the nervous system feels safe, then the body knows exactly what it needs to do, which is heal.